afternoon. Welcome to the County Health Rankings and Roadmaps webinar on using the rankings data. My name is Jan O'Neill, and I'm a Community Engagement Specialist with the County Health Roadmaps Project.
And I am Kate Konkle, and I am also a Community Engagement Specialist with the County Health Roadmaps Project.
I am Amanda Jovlog. I'm the Data Lead for the County Health Rankings Project.
And during this webinar, we're going to focus on how to get the most out of County Health Rankings and the wealth of data underlying them. We'll look at key areas to explore in your county snapshot and talk about other information that can help you further understand the health in your community. We'll also show you where you can find tools for taking the next steps for action.
The County Health Rankings and Roadmaps program is the result of the contributions of many partners, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute, and various partners who help us compile the rankings data to get the message out about the rankings and roadmaps. So we want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, on which you'll see my screen throughout the presentation. On the right, you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we will be taking questions via the control panel. Feel free to enter your questions in the control panel at any time, and we will answer them toward the end of the webinar. If we don't get to your question during the webinar, we will follow up with an email. We will be recording this webinar, and it will be available to view within a week on the County Health Rankings website.
So here's a quick outline of today's webinar. We're going to start with an overview of the County Health Rankings and roadmaps, just to get you reacquainted with our program and the site. Then we'll dive into exploring the data used in the rankings and making the most of your county snapshot. After that, we'll dig deeper into questions you could ask about your data and where to find more data specific to those questions. We'll then open it up to Q&A. After Q&A, we'll show you where you can find tools for taking action, especially data tools. And finally, we'll wrap up with some closing thoughts. And again, as we move through today's presentation, if at any time you have a question or a comment, please be sure to write us in the question box. By the end of this webinar, we're hoping that you'll understand how to interpret the data in the rankings, that you'll know how to get the most out of your county snapshot, that you'll understand how to drill deeper into the measures, and that you'll know where to find other information that can help you understand what is going on in your community. We're going to do a rapid response poll right now to see how you're currently using the rankings. And we'd like to encourage you to please go ahead and select multiple responses. We'll give you just about 30 seconds to respond there. That's what we mean by rapid, you guys. Oh, thank you very much. We've got lots of responses so far. Up to about 50% of you voted. Give you a few more moments here. Okay. This is very interesting. Another couple of moments here, and I'm going to close the poll right now. Okay, so let's take a look. Well, this is fantastic. This is great. It looks like 72, the majority of you have already shared the rankings with your community, which is great. And then, let's see, Kate, it looks like a number have dug deeper into local measures and identified priorities and selected strategies, about 21%, and implemented 16%.
Yeah, definitely exciting.
Yeah, that's great. Okay, thank you, all of you. This gives us good information. So we also asked you some questions before we started the webinar in the pre-registration, and we did review those questions. We'll be weaving many of them into the presentation itself. So we have one essential question that we organized for this webinar, and that is, how can we get the most out of the county health rankings data?
So to start, I'm going to walk us through a quick look at the County Health Rankings and Roadmaps model. So this is our logic model, and we use this logic model to explain why we create the rankings. Our goal is to create a healthier nation county by county. We try to keep the number of measures small. There are 30 in total. Ones that every county uses, already existing. We release the rankings every year. This was our 4th year for the release, and the goal of that is to attract national media attention, which gives community leaders an opportunity to use that attention to engage their local communities in action that will improve health. So the bottom line, why we rank, it's all about a call to action. We want communities to come together to improve their health. The County Health Rankings ranks the health of nearly every county in every state. And for each county, there are 2 rankings. One is health outcomes, and one is on health factors. And there are 2 separate sets of messages to convey. So how healthy is the county currently? So your health outcomes ranking we think about as a picture of today's health. And then how healthy might a county be in the future based on the many factors that influence health. So your health factors ranking is really a picture of tomorrow's health. And this is the underpinning model of the county health rankings, and it's really one of the most important things that we produce. Starting at the bottom, we believe that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. So many health factors shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure 2 types of health outcomes to show how healthy each county is, how long people live, which is mortality, and how healthy people feel, which is morbidity. So here's an example. A clean indoor air policy is a policy that can influence health factors such as tobacco use, which in turn influences health outcomes. We often point to this image as one of the most important because it outlines what we use to determine the county health rankings and what influences health in a community. And it helps us visualize why we need many different sectors working together to make change.
Great, thank you, Kate. Now let's move into the rankings themselves and start exploring the data and making use of our snapshot. So for this part of the webinar, we're going to be using screenshots so that you can get a quick feel for what's available on our site, but later we'll go into the site itself. So here's the home page for rankings, and if you click on the Roadmaps tab on the right-hand side up at the top there, well, it's on the left, but to the right of rankings, you'll find the Action Center, which looks like this. And in Roadmaps Action Center, you'll see a guide for using the rankings data. And if you clicked on that, this is what it would show you. And in this guide, you'll see 4 sections: exploring the data, making use of your snapshot, digging deeper, and finding more data. So let's take a look at the first link, exploring data. So these are all the things that you get with exploring the data, and we're going to take each of these one by one so that you can see how to maneuver on the website when you get to your county snapshot. So again, if we were to go into the home page and go to, in this case, we're going to go to Wisconsin, our home state, and then that would pull up a map of all the health outcomes showing the 72 counties in our state and how they compare to each other. Now you'll see here on the ranks, the lightest counties are healthier, and they rank in what's called the top quartile, and in Wisconsin there's 1 through 18 of those. So 1 is the top ranked county for overall health outcomes. and the darkest are the least healthy, and they rank in the bottom quartile. So if we clicked on Dane County on the map, or we could click on it in the column over here, but we'll click on the map, let's say. What we'll do is we'll get into our county snapshot. So let's take a look at what we get in the county snapshot. In the first column, we see the number for the county for each measure. Next, we see the error margin, and the error margin is a 95% confidence level. That means that we're 95% sure that the actual number, in this case, let's look at premature death at 4,627, that is an accurate number. We're 95% confident of that number for premature death. And you'll see error margin for almost every measure in your snapshot. In the next column, we see the state number. And then next, we see the national benchmark. And what that means is that we set it at 90%. It means that only 10% of counties in the whole nation do better than that given number. And so reading this across, we see that in Dane County, we have 4,627 premature deaths that falls within this error margin compared to Wisconsin, which has 5,878, which is more obviously, and the national benchmark, which is a little lower than that, but still Dane County is better. So then we can also look, we see we have a trend column, and we'll look at that next. And finally, we see the rank column. So let's look at the trend column. This year we included trend graphs for 8 measures, and most of the charts are based on multiple year rolling averages for the county, state, and nation. So, for example, a 3-year rolling average for 2008 is based on data from 2007 to 2009. And the data point for 2009 is based on data from 2008 to 2010, and so on. So premature death, or years of potential life loss, is really the most important measure of all, because at the end of the day, we want fewer younger people to die in our community. This measure is calculated by subtracting the age at death from 75 years, which is an average age. So if a child 1 year old or less dies, 74 years is subtracted. And another way to look at this is what could that child have contributed to the community had she lived or he lived a full life? And we can see in this chart that Dane County is below the state and national average for premature death. In the areas to explore, you can click on those to highlight potential challenges your community may want to examine more closely. So taking into account how each health factor measure has a different weight in our model, we used a variety of techniques to flag measures in each county that seem to have the greatest potential opportunity for improvement. We identified measures where there are meaningful differences between a county's values and either the state average, the national benchmark, or the state average in the best state. As a note of caution, these areas to explore are just one starting point for a conversation. In a county snapshot, you can also take a deeper dive into just one measure. If you looked at, for example, inadequate social support, which is a social and economic health factor, if we clicked on that, we'd see a map showing how the counties in this state, Wisconsin, split into 4 equal-sized quartiles based on each county's values for this measure only, inadequate social support. And on the left, you'll see a summary of the measure, the years on which it is based, how the measure is incorporated into the rankings, and overall statistics. What else can we get when we go deep into this measure? If you clicked on the Data tab, so we're moving from the Map tab to the Data tab, you'll see the data values for all the counties in the state. And you can see the actual values for each county in the state along with Z-scores and error margins. Now, Z-scores are just one way to it is a way to standardize all the measures that we're looking at. So if you're looking at percentages and rates and so forth, it's a way to standardize across all of them. To find the county with the best or worst value for a measure, you can click on the arrows in the Z-score column header to sort the counties from best to worst or worst to best. Now, we just looked at the map for that measure, inadequate social support, and we looked at the data. You can also click on description to see why we included this measure in the rankings and its strengths and limitations. You can also click on the data source to see where it comes from. And you can click on policies and programs that are potential strategies for addressing the focus area that the measure represents. So strategies for inadequate social support. There's a number of strategies in the What Works for Health database. And the ones that you see here on this screen are the ones that are scientifically supported, but we rate them all the way down to insufficient evidence or perhaps that they don't work at all. So this is a good one to link into there. Now, if we went back to the snapshot, you can compare your county to a number of other counties in your state for both health outcomes and health factors. So if I clicked on that, it's really helpful to do that, to compare your county to others that are doing better and to get curious about what they're doing that perhaps you might emulate. Another thing you can do is download and print the data from each of the rankings years, so for all 4 years. You could also print out the comparison of counties. And you can print out entire year's worth. You can also use social media to send your county snapshot or email it or tweet it. I'm just going to pause. Do we have any questions, Amanda or Kate, at this point? Okay. I know this was one of the questions, actually several people in the pre-registration asked about, what do the measures mean and how can I find out more about where they come from. So hopefully by going through this with the screenshots, people can see that they can go in and get their answers by looking into their county snapshot.
Okay, so let's take a deeper look at Dane County snapshot on the actual website, and we'll look at health outcomes, health factors, and areas to explore first. So Jen, how does Dane County rank?
Well, let's go to the website to do a little live search here. And what I would like to do is let's go back to the home page. And what I do is exactly the same process there. I'm going to click on Wisconsin. And I could pull it up over here and find Dane over here. Or I can find it here. I'll just click on the map. And what this tells me is that this year, and here's the year, 2013, we overall rank out of 72 counties, 15. Okay? And then, of course, it breaks it down by mortality, morbidity, and by health factors overall, and by each of the health factors.
So it looks like we're doing a little better in our health factors. I think that's a good thing.
Mm-hmm. And we're in the top quartile for both, which is great. So we're one of those counties that says, so we're above average. We're a Lake Wobegon, right? Okay.
All right. So how do our measures compare with state averages and with those national benchmarks that you looked at?
Right, right. Because that's really where you want to go next in this, and you want to be looking at Dane County's numbers, your county's numbers, and of course your error margin. Now, one comment about error margin, and Amanda, I'm going to turn to you here for a moment before I dive into whether better or worse. Now, Dane County is not a particularly small county, but if we were a small county, what would be the caution on the error margin?
I think with any error, I think what you'll note is that as counties get smaller, the error margins get larger in general. And so you just have to, as your error margins increase, you have to be more aware when you're comparing to something like Wisconsin or the national benchmark to consider whether or not your error margins are overlapping with those Wisconsin or national benchmark. If they are, you might want to consider looking back in previous years and seeing if this is an outlier from other years of data. That would be the guidance I'd give for smaller counties.
Thanks, I appreciate that. We just wanted to make sure that smaller counties, especially because they can be so, the error margins can be so wide. So, Kate, you were asking how does Dane County compare to the state and compare to national benchmark? So my first answer to that, I'm going to look at premature death. And by the way, notice when I scroll over that, that tells me what that measure means. And I'm going to look at the trend. I mean, that's going to be important. I want to get a moving picture of that. And what this tells me is that Dane County has been consistently below the state, which is good, and consistently below the national on that. Now, we may be leveling out a little bit. I've looked at other counties. We looked at one just this morning where there was a big dip here coming down, which is good. That's what we want to see. But for right now, what this tells us is that we're doing better than the state and better than the national measures. And it looks like the trend is, at least it's stabilized, maybe coming down a little bit. Then if we look at poor or fair health, it looks like we're doing better than both. And as we said, in poor physical health, we're actually doing worse than the national benchmark, as I mentioned. Poor mental, we're doing worse, but we're always doing better than the state. And then if we scroll down and look at the health factors, we can just compare again our numbers over to the national and to the state. And so, did you want me to go further with that?
No, I think so. Looking at those numbers, where do you think Dane County is doing particularly well?
Well, again, I would want to, it seems to me that it looks like adult smoking, we're doing pretty well. Yes, we're worse than the national, but we're bringing it down, and I know that there's been a lot of efforts locally to work on making it more difficult, for example, for young people to start smoking. So I would say we're doing well there. If I look down in clinical care, preventable hospital stays, that looks like we're doing pretty well. And I'll look at the trend chart there. It's below both. And then I would look in, let's say, social and economic. I'm just going to pick one from each. Our unemployment, we're a university town, we're a government, our state capital's here. Consistently, that's pretty low. And again, it looks like on the trend chart, it looks pretty good. And then access to recreation under physical environment, we're looking pretty good there as well. So I would say those are our strong points. I mean, there's others, but
sure,
those are 4 to pick out.
And we know that, even though Dane County ranks relatively well, we know that we have areas that we probably need to improve, other than our weather.
Oh, don't get started. Well, spring's here. It's finally arrived. Okay, so let's see. Where can we get better? Well, I look at dentists, for example, oral care under clinical care. It looks like we definitely could get better on that. And I look at children in poverty. I know that's a trend nationwide. Let's look at that trend chart just for Dane County. That looks like that's increasing. I'd be really concerned about that. And I know that's been really hitting our schools. We're well over 50% free and reduced. Some schools it's closer to 70 and 80% free and reduced lunch. And then I guess, I'd come down and I'd look at our daily fine particulate, our air quality, and I think that's an area we could improve. And it also looks like fast food restaurants, 50% are fast food, college town. So those would be areas. Right.
So is there one factor that looks like it ranks less healthy than others?
Well, I guess I would look at, I would really look at those preventable hospital stays. And I know that social and economic factors, 40% of our model is there. I'd really want to look at the issues around children in single-parent households and children in poverty. But right now, well, should I turn on the areas to explore?
Yeah, let's do that.
Okay. So let's click on that. Whoa, that's surprising. I just told you that adult smoking, we were doing better. That got flagged. And you know what? Adult obesity, let's look at that. I didn't flag that one, but it got flagged here now because we're doing better than the state and the nation on that. Amanda, could you help explain this?
Sure. We developed areas to explore as a way to just provide some guidance to counties about places they might want to look at for health improvement are the choice whether to flag or not to flag in this case is made when we look at comparing the county's number to either the state average or the national benchmark or some other benchmarks. Those are not the only pieces of information that are included in this. For some measures, we include any measure that's in the lowest 10th percentile. So it's kind of the opposite of the national benchmark. It's the lowest 10% counties are flagged to give a bit more of a national comparator. For adult obesity has been rising so quickly in most counties around the nation that we don't use the national benchmark as our comparison. We use the state of Colorado average, which has the lowest rate of obesity in the United States, because it's such an important predictor of health in the future that we want to ensure that counties don't set the bar too low, that they make sure they are working on this, even if it looks like for their state they're doing pretty well. The same is somewhat true of adult smoking. Although some gains have been made in recent years regarding smoking rates, it's still a huge predictor of health, and we don't want counties to lose sight of the importance of this factor of reducing smoking in their communities. So some communities, particularly ones like Dane County, that overall don't have a lot of risk factors that are identified, they're going to be more likely to have adult smoking and adult obesity marked than other counties do.
Well, that makes a lot of sense, because you're really focusing on those things that have the biggest impact on our health. And I guess the question is, what's good enough? You know, we don't want to be satisfied with 15% of people are still smoking. We don't want to be satisfied with 24% are still obese. So that's good. It sort of gets our attention and says, yeah, there's always more to work on.
Exactly, and I think the other point there too is that, you know, the areas to explore are a great starting point for conversation. That we might look at these and say, hey, you know, 15%, we know that we're making improvements there, but maybe it's not quite enough, or maybe we need to make sure that we are continuing the hard work that we know is going on to keep those improvements going and to continue to get better in that particular area. So they are by no means the end of the conversation, and you should just take those as your priorities. They're just starting points for the conversation, because we know, as you've heard Jan and I talk a little bit about Dane County, where we live, that we have a lot of other local information and knowledge that we can add to the data in the ranking. So the data is a great starting point to get us talking about some of these different areas, but bringing your community together to talk about the data and to contribute the rest of the context around that is a really important step in exploring your data further.
Right, I guess that's the big takeaway here. This is a place to start the conversation, not a place to end it. It's an entry point.
It's also important to remember that rankings aren't comprehensive. They're really just a place to start the conversation. So you may want to look at the additional measures page. You know, the rankings provide a lot of great data on the areas that really have a big impact on health, but again, every community has different challenges and different strengths, and things going on in your community may not be reflected necessarily just in that set of data that's available in the rankings. So the additional measures is also a place to get some other ideas for data you may want to look at.
And every county is different, right, in terms of the additional measures that they have available, Amanda?
Well,
they're not consistent.
Most of the states will have the same additional measures available.
All right.
Yes, that's true. There's some state-specific measures that are submitted or that we gather for a variety of reasons where they're available.
Okay, great. So just so we understand, these are measures that are not included in the rankings, but they're additional data, and we could do a deep dive into any one of these and find out more about where that measure came from and go to the original data source.
Absolutely.
And maybe even get down to zip code level some of it.
There are some cases where zip code data is available.
Okay, awesome. That's really helpful. I think this also sends the message that it's not just about the rankings. Again, going back to the logic model, the rankings are to call attention, to give leverage to a community, to mobilize. And then the real work is digging deeper into the data. Okay, great. Well, do we have any questions yet at this point? I can try to. That anybody? If not, that's fine. We're probably doing such a great job.
So we do have some questions coming in, and we can start to address some of those before we move on to the next section of the PowerPoint. So, so one question we have is about some of the measures in particular. So what changed in the area of physical environment that impacted the ranking?
This year we had a few changes in the physical environment. I'm just going to pull up the rankings really quick to make sure that I don't answer them incorrectly.
Would you like me to go back there? I can go back to it also.
Sure, we'll get there at about the same time.
Yeah.
By the time we get there. In the physical environment, we changed our measure. Well, I guess for the first time this year we had a measure of water quality that was available nationwide that compared the water safety in counties around the nation. The inclusion of that measure was a pretty big change in our measures of the physical environment. We reduced our air quality measure to one measure rather than two, and changed it from prior years because of data availability. We no longer had any updated data for our measures of ozone quality days, so we changed to a new measure of average daily fine particulate matter. Those two changes are probably the most dramatic. There was a slight change in the way that the limited access to healthy foods was calculated. It had more specificity about areas that were considered rural versus areas that were considered metropolitan, and improved the measure, but it did change it, particularly for counties that have some rural and some metropolitan areas, a mix of areas. They'll see the biggest change.
And I think that brings up a really good point, that question does, that our health factors measures do change slightly from year to year, and we know that a lot of counties like to go back and compare the data from, say 2010, since we now have several years of rankings. And certainly looking at the data over time is a great way to sort of see what's going on in your county over time, but to do that with caution, because it's important to remember that not all of those factors stay exactly the same year to year. So certainly look at data over time, but when you're using the rankings data, to just be careful about doing that with every measure.
And that's where it's so important to develop your own local measures. And in the Roadmaps Action Center, we can show where to find those. Exactly. That was actually one of the questions in the pre-registration as well. Okay. Anything else on that? Okay. So let's go back to our.
All right. So now that we've explored the data and looked deeper into our county snapshot, let's look at the guidance for digging deeper to find more data for those areas that we would like to improve. And recall that we can go to the roadmaps to find the guide for using the rankings data. You click on that button there. And this is what that guide looks like. We've looked at the guidance for exploring data and making use of your snapshot. So now let's look at digging deeper and finding more data. So again, Jan and I are kind of walking through a community conversation, although there's only two of us, and we hope you'd include more people in your community conversation. But how you would maybe, the questions you're going to think about asking and how you do this in your community. So we're going to go into the next two parts of this particular guide. So in digging deeper, we provide some guidance for asking questions, and these are really just starters. It's certainly not an exhaustive list of things that you might like to ask, and you'll probably have a lot more questions. We also have more examples in our Assess Needs and Resources guide. But for example, with premature death and quality of life measures, You want to think about what the causes are and what the patterns are. And then we can also include questions for each factor. So again, this, depending on what you want it to dig deeper into, coming up with some questions that you'd want to ask your partners in the community who might be able to contribute some more information, and or again, looking at some more local data that you have available to you that can give you some more information, breaking down those numbers by different populations in your community. For example, we provide the number on adult smoking, but wanting to know what does it look like for pregnant women, or is there a different population that might be impacted more by something, by a particular measure than another. You know, you may want to also look at the percentage of children that are fully immunized. This isn't something that's available in the rankings, but again, maybe an important thing to think about in your community. Are there any racial disparities in high school graduation rates? So again, thinking about special populations, vulnerable populations, just what does it look like really in your community as you start to drill a little deeper? So once you've identified areas that you'd like to learn more about, you can find state and national sources of data. The data sources listed provide at least county-level data summaries or reports, and some may provide census tracts, zip code, or other area data. Some states also offer online query systems that allow users to display information by race, ethnicity, geography, social and economic status, and other demographic characteristics. And some will let you customize maps or display trend data so that you can see change over time. We want to mention chna.org as a site that we help devise and which uses the rankings model as a framework and includes rankings, measures, and more. It's a really great resource, additional resource for people looking for some more data. And again, if you go into that the guide and you click, you can actually click on a link to your state and the data that you can find that in your state at a local level. It's a really helpful tool if you're not quite sure where to start at getting some more, but you likely also collect some local data that you can utilize.
Okay, what you're saying is that, and I can bring the website up if anybody wants to see it again, but to dig deeper, we have the links to all the state sources, and we have those questions already up there, so they don't have to, although we encourage them to come up with their own questions too, but we have prompts that will get them thinking along those lines.
We have a starting place so that people who aren't quite sure what the next step is, that can be your next step, and then hopefully that will encourage you to continue to explore further.
So again, if anybody wants us to go there, we can go to the website, but what we'll do right now is open it up to see if there's any questions, and I do have a couple of questions that have come up as well. Do you see any there that you would like to throw out on the table?
We do have some questions, and one is how and where do we get the actual numbers? And again, Jan walked through, when you go into your county snapshot, for each of those measures, you can click on the measure and it will take you into the measure detail page, and that will tell you exactly where the number comes from, what data source we get it from. You can click on the data source and get more information about what, you know, if it's a behavioral risk factor surveillance system, what exactly that is and how they collect that information. So for each of the different measures, we certainly encourage you to go in and explore, because it is different for each measure.
Do we make up any measures? Do we come up with them ourselves, Amanda?
No, all of our data comes from national sources.
And in some cases, like with CDC, they'll give us county specific. That I saw that in one of the measures that we don't necessarily, but that they're working with us. That's one of our partners.
Yeah, for any measures that come from the BRFS or birth or mortality data, we don't actually have access to the raw data. We get calculated estimates from CDC or the National Center for Health Statistics.
Great. Ashley, that kind of leads this. One of the questions that we got is how to get to county level raw data. Is there a way to do that? County level raw data? Is that a question?
County level raw data probably counties are more likely to have access to that than I am. I think that would be really a measure-by-measure question. If any state or county would like to find access to raw data, they should feel free to contact me. There's a few measures that we do have that for drinking water and for, well, that's the only one I can think of off the top of my head. But if they're interested in exploring any measure more carefully, feel free to just contact us, and I'll be happy to help.
We also have a question, likely from a very small county, that this particular county doesn't have statistics for each of the measures. So some counties, maybe all of those measures don't have numbers. Mm-hmm. So can you tell us why some
Sure.
counties might be missing their measures?
Sure. Missing measures is generally due to too small of sample size and privacy protections. So CDC does not release data from the BRFS. If the behavioral risk factor surveillance system, if there's fewer than 50 respondents, measures of birth and death, for birth and death data don't release data if there are fewer than 10 deaths or births. Different organizations, high school graduation has certain limitations regarding releases of data for privacy reasons. Mostly that's the reason. There are a few measures in Alaska and Hawaii that are measures of the environment that are there because they just don't measure them there. They don't measure the air quality there. I think it is. I don't think it's access to grocery stores anymore. Those would be the primary reasons.
So yeah, and I think if you live in a small county that has a small population, you are probably used to the frustration of not always being able to get great local data, and we unfortunately have those same restrictions that you do. Mm-hmm. Again, we encourage you to use the rankings as a starting point for conversation, and again, those measures, even if you don't have great data, the measures are also there to make sure that people are talking about those particular areas in terms of how they might contribute to health. So hopefully you can maybe find some good local data or do some forums or surveys within your community to get some more information on some of those. But hopefully it at least starts the conversation for you, and maybe eventually we'll solve our data issues as a nation.
Other questions?
So a question about, do some counties only use the county health rankings data to write their community health assessments and health improvement plans? My answer to that is I don't know, but we hope not. The rankings are definitely not intended to be a comprehensive community health assessment. Again, we limit the number of measures we use so that they're understandable for communities, so that they, again, can be a conversation starter, so that they can get communities talking about health and the many factors that influence health. And so again, we certainly think that they could be included as a tool and a starting point, but really what we're talking about today, the digging deeper, the looking for additional data, the using the measures as a starting point and then going further, that's really where we hope the community assessment would go. And we do have great tools and guidance available in the Assess Tools and Resources Guide available in the Action Center that can give you some more guidance in how to use the rankings as a starting point to do a more complete community health assessment and improvement plan.
And there's a question I see about Gallup doing ranking, and how does our tool compare with other rankings? Isn't there's a crosswalk though?
We have two crosswalks included. One that compares our rankings to the America's Health rankings, and one that compares it to the Healthy People 2020, which is not the same. Mm-hmm. The Gallup survey is something we keep track of to see their measures are there some coincidences or some similarities to ours. Their goal is not quite the same as ours, and they measure cities and congressional districts of states rather than counties. I think we fit into a matrix of rankings of health and well-being around that are happening.
So I think that's going to about wrap it up. And
I think that looks like most of the questions. I think we've answered most, or we can get back to you.
And again, if you feel like we didn't address your question and you'd really like us to get back to you, it's very, we'll let you know in just a moment here how to reach any of us, and we'd be happy to get back to you personally on that as well. So let's see. Now let's take a look at where you might go next once you've understood your rankings. Remembering again that it's the beginning of the conversation. And if you go to the Action Center, again, if you went to the home page and you clicked on Roadmaps, you'd find this Action Center. And in the Action Center, you'll see the Take Action cycle. And for every one of those orange titles, you can click on them and find a complete guide. If you went to the Assess Needs and Resources step, what you'd find would be the guide, a guide that would look like this. And all of these are links to the complete guidance for how to take the next step with your county health snapshot. We've also got highlighted, we call them sort of the top 10 tools, or 5 to 10 tools that we think are really essential for the step that you might want to take a look at. And we also, I want to point out, have all last year we did the Take Action series with communities that were using the rankings to take action. And so these webinars are all archived, as will this one be, on our website. And you could go in and see what the handouts are for that and listen to the recording. And so that's another way to learn how to take action and where to go next. One of the things that I think if you, as you move from reviewing your county health ranking snapshot, you'll see that the next activity is define your community. So it's very important that the county health rankings are just, that's really county-wide. But if you had a more specific, more local focus, you would want to define now what is the focus of that community, who is in that community, who do we need to talk to learn more about what's going on in our community. Conversely, you might be in multiple counties, so you would want to look at multiple snapshots and multiple communities. And then, of course, you'd want to generate questions about your community. There's guidance for that in this whole activity guide. I'm just showing you the first top page of it. And Kate was talking about some of the questions that might prompt. You might use as prompts along the way. We mentioned that some folks were talking about using rankings as a way to measure progress. And we'd really encourage people to go in and look at evaluate actions and do that early on, because that will help you develop your local measures for how you know you're making an impact in your community and how you communicate that. And speaking of communicate, we also have a lot of guidance on how to communicate your rankings data, how to communicate data in meaningful ways, not only to your community but to the media. We have talking points for that, how to engage decision makers, policy makers, and so on and so forth. So there's a very comprehensive guide on communicate. And then I'll put a plug in for work together, because that guide permeates everything. You know, how do we collaborate? How do we partner? And there is a webinar coming up on the 30th of this month where we will be interviewing the 2 lead folks from the Community Toolbox on the big issues around partnering with other organizations and other community members. What are the issues there? How do you come to common ground, and so forth. So to sum this up, we encourage you to come to the site, and you can find great examples of what communities around the country are doing to improve their health. And 6 communities in particular were recently recognized by Robert Wood Johnson Foundation, and their video stories can be found on the site. That's a great thing to go and look at to see kind of the vision of what different communities in different parts of the country are doing. They're all very innovative, and all of them require partnering across multiple sectors. And so we're now open for a second round of prize applications due May 23rd. So take a look at that. That might be something that your community would like to get put an application into. And there's also lots of other stories you can read and view. It's great inspiration for communities of all types. I mentioned also that you can always feel free to contact us. There's 3 community engagement specialists thanks to the support of Robert Wood Johnson Foundation, and our assistance comes at no cost to you thanks to our WJF. Please don't hesitate to email or call us. We're here to help, and if we can't answer your question, we will send you over to Amanda, who can answer all questions at all times. Amanda's, yes, yes. And as always, we invite you to stay connected with us. You can follow us, our county-by-county blog on countyhealthrankings.org. You can follow us on Twitter. You can like us on Facebook. And please subscribe to our e-newsletter because that's where we announce the new webinars coming up. And finally, today's webinar focused on this essential question, and we hope that we've answered this question for you and that perhaps now you have some more questions that will take you to the next step in your journey. We'll just end with this quote. The rankings, as we keep saying, are a starting point for the conversation, not an ending point. And as someone once said, you cannot feed the hungry on statistics. So now that you understand how to use the rankings, we hope you'll use them to start a conversation, continue the conversation, and take action in your community. Go beyond the statistics. So thank you very much, and we hope you'll fill out the evaluation. We really value your opinion, and we hope to hear from you in the future. Thank you. And thank you, Amanda and Kate.